Hello everyone, welcome to my YouTube channel where we share information on health, lifestyle and spiritual growth. If you're new to this channel, please hit the subscription button so that every time I upload a new video, you get a notification. Today the weather is a bit cold outside. It's really chilly and I'm enjoying myself. Today we want to share about diabetic retinopathy. We want to describe what diabetic retinopathy is, what causes it, or the risk factors, how a person who is suffering from diabetic retinopathy presents, and then also we want to look at where you can possibly get help if you suspect you have diabetic retinopathy. Now, what is diabetic retinopathy? Diabetic retinopathy is a disease in which the small blood vessels of the retina of the eye are damaged from elevated blood sugar levels over a prolonged period of time. Three things we have to notice on this description of diabetic retinopathy. It involves the small blood vessels of the retina and also the elevated sugar levels and over a prolonged period of time. So when you hear about this diabetic retinopathy, I think you already understand which kind of people are most likely to develop this condition. Those are the people who are suffering from diabetes. Because diabetic retinopathy is simply a complication of diabetes. Now, what are the causes or what are the risk factors that expose someone to diabetic retinopathy? The first one is uncontrolled sugar levels. Now, if you are a diabetic patient and your sugar levels are uncontrolled most of the time, you have high chances of progressing to develop diabetic retinopathy. And then secondly, if you've had diabetes for a very long period of time, you are also a candidate to developing diabetic retinopathy. The other risk factor is hypertension and pregnancy. Now, pregnancy is if you are non-diabetic and you're pregnant. Pregnancy usually is associated with a rapid progress of diabetic retinopathy. And then also kidney disease is also associated with a worsening of diabetic retinopathy. So if you have kidney disease and you're a diabetic person and you develop diabetic retinopathy, it can worsen very fast. Now the other risk factors I want you to be on the know is smoking, alcoholism, and living a sedentary lifestyle. It all exposes you to diabetic retinopathy. Now, how does a person with diabetic retinopathy present? This person who has developed diabetic retinopathy usually comes to see a doctor, a medical worker, with complaints of sudden loss of vision, and it's usually painless. Sometimes it can be gradual loss of vision, which has occurred gradually over a prolonged period of time, or sometimes this person may not even know that he or she has developed diabetic retinopathy, but the medical worker on examination of the patient's eye may notice or discover that this person has diabetic retinopathy. As I said in the first presentation, that it is usually painless. So these patients normally don't have that high urge to go to hospital. By the time they happen to go to hospital, it's because the vision is gone, they have lost the vision. So that is what now makes them to move to the hospital to find out why aren't they seeing well. And remember, by the time you're not seeing well, it means already the diabetic retinopathy is in its late stages. Actually, in early stages, the person sees and it is painless, and the person does not notice that his eye has any problems. Until the person starts to lose vision is when they normally notice they have a problem. However, all this can be stopped. Usually people with diabetes are urged to visit eye specialists every now and then, to be examined, for their retina to be examined. There's a procedure that eye specialists do. It's called fundoscopy. They dilate the pupil and they view the retina of the patient to see if there are any signs of diabetic retinopathy, so that if it discovered early enough, this person can be treated and vision can be saved. Today, that is all I want us to understand. Please ask yourself, have you gone for any eye checkup? Have you tested for diabetes? If not, please go to your nearest health facility, check your sugar levels, and please, if your sugar levels are high, if you're a non-diabetic patient, please ensure that you visit an eye specialist at least every 6 months and have your retina examined for diabetic retinopathy. Thank you very much. Have a blessed day.